for taking this as well. Deputy Buckley, you
Thank you, Minister, and I do welcome this opportunity to speak on this extremely important issue tonight. I suppose, firstly, Minister, we've been informed today by groups working on the front line that the Specialist Access Team for Homeless People with severe mental health difficulties located at Cunningham Road in Dublin is now closed to new referrals due to staff shortages. This special community mental health team for homeless people is a vital service that liaises with homeless agencies to ensure that at least some people within the homeless services who are very unwell can access appropriate mental health care. The absence of this service is likely to lead to people with acute psychosis not getting the appropriate treatment. We know that homelessness is at an unprecedented level, with over 10,000 people, many of them parents of young children, suffering because of the housing crisis. They are forced to couch surf, to sleep in hostels, on cots or in hotel rooms, totally inadequate for anything other than the shortest of emergencies. Some feel they have no choice but to sleep on the streets. These people are under huge strain, and the damage that this experience is doing to their mental health should be clear to anyone who cares enough to consider it. We know that those who suffer homelessness are seriously vulnerable to mental health problems, not just because that is a common sense approach, but the statistics show it. 47% of people in homelessness last summer were found by Simon and Mental Health Reform to have at least one diagnosed mental health condition. Those are just the ones that can be diagnosed. We know that these strains lead to a worsening or development of substance abuse problems, which make recovery and rehousing even more difficult for the individuals and the services. A survey has found that 17% of those surveyed had attempted suicide in the previous 6 months, and 19% had engaged in self-harm. 21% said they had experienced barriers in accessing mental health care. Now, Minister, the accessing of services is difficult enough. And we also have the issue of, these are frontline people that, provide a vital service. And yet again today, we're heading into the winter time now when people, that are in the dire circumstances of being in a position of homelessness and have mental health difficulties, and a lot of these are severe difficulties, that we have a situation today where no more referrals are going to be taken in this centre. I can't understand why we have this issue coming up all the time about staff shortages. Can we find out when this is going to be resolved? Can we find out, was this flagged up beforehand, Minister? Because it seems to be a recurring thing here. It seems to be staff shortages, no forward planning, and it keeps becoming over and over and over again. And I'm also very conscious in the last number of questions there, in one of your answers, Minister, you mentioned about the staff morale. And it's very, very important to acknowledge, the staff, and in extremely, extremely difficult circumstances, who are doing their very, very best. And these are our, the frontline staff here. And we as, I will say, I suppose, we as legislators, we as in government, I feel are letting these people down terribly. And we're well aware that, things are going to worsen. And I would just like to know, is there anything that can be done to resolve this issue as soon as possible, or unfortunately we will be facing more deaths on the streets. Good Emil Margaret.
Thank you, Minister.
Yeah, Carla, first of all, I want to thank Deputy Pat Buckley for raising this very, very important issue. And I'd like to take this opportunity to emphasise that mental health remains a priority care programme for government. Since 2012, around 200 million, or 28%, has been added to the HSE mental health budget, which now stands a total of 910 million. On top of this, we have secured an additional 55 million for new developments in the recent budget. Despite serious financial pressures overall, 2019 will see a total HSE health mental budget of almost 1 billion, an increase of 40% on 2012. Dual diagnosis in particular has been given specific attention. The HSE Mental Health Division has recognised the need for a clinical programme for dual diagnosis to respond to people with substance misuse, both alcohol and/or drugs, together with mental illness. The aims of this programme are to develop a standardised, evidence-based approach to the identification, assessment and treatment of comorbid mental illness and substance misuse. This includes increasing awareness of the frequent coexistence of mental illness and substance misuse, ensuring that there is a clear pathway for management of people with such a dual diagnosis, including where they present to emergency departments, ensuring a standardised service is provided throughout the country, ensuring that adolescents are included within the scope of the clinical programme. An additional €2 million in funding was made available from the €35 million mental health new development funding in 2016 to address specific needs of homeless persons in the Dublin region, with a particular focus on mental health needs. A key requirement was that any mental health supports provided would be provided as part of an overall cohesive response to homelessness. This €2 million has helped to fund the expansion of in-reach services and supports for temporary accommodation for charities such as the Peter McVerry Trust, Crosscare, Sophia House and the Dublin Simon Community. The additional funding has continued to be provided to fund these additional services for homeless people with mental health and addiction needs. As part of these services, the Access team is based in Parkgate Street House, Cunningham Road, Dublin. This specialist community mental health team for homeless people is a service that liaises with homeless agencies to ensure that people with homelessness services who are very unwell can access appropriate and mental health care. I understand that Access is currently unable to take on new referrals, so I take your point earlier on, Deputy Buckley. The HSE has informed me that there are vacancies at psychologists, at social worker and occupational therapist levels. So that is the current situation. While the psychologist is on maternity leave and is due back in March 2019, the HSE is attempting to recruit the new social worker to the National Recruitment Service, and the occupational therapist has recently been appointed and is awaiting a start date. So there will be a social worker on the way, and also the OT has recently been appointed and will be waiting a start date. Thank you, Carla.
Thank you very much, Minister. Deputy, final 2 minutes.
Minister, firstly, I do thank you for your answer, and I suppose going to revert back to one. I mentioned this earlier on about the problem with staff shortaging, but also forward planning. It's not a personal attack on anybody, but if somebody is going out on maternity leave, surely there's forward notice, or somebody will actually cop on, somebody is actually expecting maybe, that they are going to go on leave, and they're totally entitled to that. But surely there has to be something put in place where the HSE can forward plan and know that Mrs X is due to go on maternity leave on such and such a date, that they should be able to recruit and fill that gap. Temporary. March is 5 months away, and we're into October, November, December, January and February and March, which are very, very bad months here. So, I'm not very optimistic on the forward planning, as we call it. I'm not surprised. A psychologist, a social worker, an occupational therapist, that's a huge gap. That's a huge gap in services. And how have the people, been coping with this all along? And it goes back again to the morale of the people that I have there on the front line. But surely to God, I'm black and blue from coming in here and asking whatever minister is there and in committee, asking why cannot the powers that be and the HSE forward plan? We've said it over and over again. We're facing a major dilemma here coming down maybe in the next couple of years as well. We're going to have possibly 500 people within the mental health services retiring. And nobody's planning for it, because the system works on a basis of they have to wait first for the individual to retire, and then it goes into a 12-month cycle, and the crisis is getting larger and larger. So it's something I want to highlight. It's not a personal attack on you, Minister, and I do appreciate the answers you gave me, but I am very, very disappointed that, again, we don't have forward planning. We have now another emergency in Dublin with people that are going to be severely affected, plus not mind with mental health difficulties and weather, but we're being told that the best that the department will do is we'll see you again in March.
Thank you very much. Final comment, Minister.
Yeah, I just want to say, first of all, I want to thank Deputy Pat Buckley for highlighting the issue, because it is a very important issue. And of course, I take your point in relation to forward planning. And that's a strong message that we'll have to bring back to the HSE. And I'll bring that message back to Minister Simon Harris as well. But can I assure you, Deputy, but from a government point of view, we are committed to ensure all of those who are in need of mental health services and supports have access to them. This particularly includes vulnerable groups such as those who are homeless and those people you talked about earlier on. It's not acceptable, as far as I'm concerned, that somebody is homeless and poor and marginalised and can't get a service. There is a broad range of support initiatives underway or planned across the mental services to cater for this group. And I believe that these initiatives will help us to achieve the equity of access and support these individuals to access care at the earliest possible points. And I do take a point in relation to the access team. They take in the region of 10 to 15 calls per week inquiring about referrals, and that works up to around 150 to 200 per year. But that's something, these are figures that with a bit of forward planning, as you say yourself, and we have the money is not the issue, it's the planning is the issue, implementing the services and getting the people back. But we do seem to have a regular, I have it in my own sector, in the disability sector, a regular issue of having difficulty filling posts. And I know that in recent months that we've had a steady stream of OTs, occupational therapists, speech and language, returning from, particularly from England, who returning immigrants, and that's something that's going to help as well. But the answer to your question is, yes, absolutely, we need more forward planning, we need to get in there and we need to resolve these issues, and I'll bring that message back to the Minister and the HSE.
Thanks very much, Minister.